We're going to go ahead and take you through the C.A.R series right now. The first one that we're going to do is going to be taking you through your neck. What she's going to do is the beginning part is often kind of overdone fast, and we really need to make sure that that part's slow too. It's arguably the most important. So when we're starting off, I want you to think one by one, actually tucking your chin so that each vertebrae in your neck actually slowly tucks down. So once she does that, we're going to think about having a marker on her chin. We're going to draw a circle. She's going to start rotating in a direction. As she rotates, I don't want her to side bend. So a lot of people are going to do this kind of crazy little crink in their neck thing. We don't want that. The neck needs to move in a circular motion because remember, we're controlled articular rotations. The rotation is a circle. So she's going to do 2 in each direction. If she had any pain here on the right side, that's closing angle pain, big red flag. Make sure you never go into any closing angle pain. Really, none of these should be painful. She can make her circle smaller, even if it's as small as this. This is better than not moving your neck at all. So make sure that you're really paying attention to that. She's gonna reverse directions. We're gonna do 2 in the other way. As she comes around, we're gonna slowly tilt the chin back and then rotate from the neck all the way to the other side. Thinking about kind of drawing that circle. I'm gonna do 1 more, just following through. Make sure you're always doing both directions. Can't say how important that is. And especially you can even double up if you notice that when you turn left, there's much more resistance, a little bit harder. As you go one way, if I go to the right, I should feel a stretch on the left. Okay. So from there, we're going to go into our thoracic C.A.R. She's going to go ahead and turn to the side so you can see this. What I want her to do first is just get as long in the spine as possible. So she's super tall. She's got her chin, nice little double chin. We're really, really up there. And now she's going to slowly round just her upper back. Think about a nice little turtle shell back here. You can see she's really good at this, and that's still not a lot of range of motion. It's not supposed to be. It's just a little bit. Once she turns, that's rotation. Again, just like the neck, I don't want her to side bend. I want her to actually turn her rib cage. Just like a baseball player, if a baseball player wanted to hit, he wouldn't go like this. He would open and rotate. So from there, going all the way around, we're looking for just movement in the thoracic spine, not the lower back. We don't want the hips to move. We don't want them to turn. She should feel one by one each individual vertebrae in her upper back extending. So think elevator floor 1, 2, 3, as it just climbs up that spine. Once we get those 2, she's going to reverse directions. We're going to go to the left. Again, visualizing the rib cage actually turning and rotating. Once she extends, we get that nice little 1, 2, 3 up the spine, and then come on down to the other side. Another thing that's going to really happen early on with your C.A.Rs, with your thoracics, you're going to end up thinking that your neck is your upper back. So make sure you're not just tilting your head back. You're keeping the chin in a good spot, learning to dissociate the neck just from the upper back. Just like your golf swing, if you look down and all of a sudden you just threw your neck and your upper back in the same direction, you wouldn't even be looking at the ball anymore. So that should make a lot of sense. Next one we're going to do is going to be the shoulder. She's going to go ahead and stay facing this way. Start with that left shoulder. Elbows locked out. We went through our procedure. The abs are tight. She's going to go all the way up, and I want her to pause when she goes up. So we're going to stay here. You can see that Ewan is very cleared for overhead pressing. Right now, you guys can see her ear, at least a little bit. That's what we want. And she doesn't necessarily need to bend the elbow or lift the ribs to do it. One of the things I actually would correct here is have her look straight, and now she's going to be able to get her spine up, and you see she just gained another little ½ inch. Okay? From there, we're going to rotate from the shoulder and continue to reach back. As she does that, think about the shoulders actually turning, so you're actually getting rotation from there. Once she comes back, she's going to go into extension, max that out, and then eventually rotate out, which is external rotation. Coming all the way through, doing 1 more. You don't have to pause on this one, just come all the way through it. The other point that I wanted to make is, again, thinking about really having rotation happening from the shoulder. Even though the hand, the elbow are going to rotate, you're really thinking about the shoulder. When she comes back here, I want her to emphasize pulling behind her ear. So after she rotates, I want her to actually get behind her ear. So don't just let it flop forward. Try to pull right back into that corner of the shoulder where we're going to be pressing. Okay? Go ahead and flip, and let's face this way. And now you can see it from the front. We're going to do that right shoulder. From here, nice and strong. Really look for elbow bend. We want to look for this left shoulder turning also. The ribs are staying down. Everything is locked in. Our goal is independence before interdependence. So before I want her to shoulder press and do a squat at the same time, I'm going to ask her just to be able to use her shoulder. So that's really our basis for our C.A.Rs, and it's really, really important that we get that understanding. Once everything moves independently, Everything's gonna work so much better together, and that's really one of the big goals of our cars. So from there, reaching back, this is your external rotation. If you're struggling with this part, then you're gonna actually need that Americana that you'll find on my channel for external rotation of the shoulder. Next one that we're gonna go into is gonna be for your scaps. So we're gonna actually have her turn around because she wants to show you her back muscles, which are very well developed and worked hard for them. So we're gonna use that. We're gonna go ahead and straighten those arms all the way out. And now she's gonna reach through her fingers. So I want her to radiate tension through the whole entire finger elbow complex. As she does that, we're gonna reach forward and hold. So as she's holding here, I want you to see it's like a stretch and her shoulder blades are fully protracted. From there, we're just gonna squeeze back. Keep squeezing and crush my finger. Think about there's a walnut, hold that. 3, 2, 1, forward again. Nice, good. So you can see that slow control. Aim for at least 3 seconds in each direction. Now we're gonna go up, so she's gonna bring her shoulder blades to her ears. Now she's gonna go back, now down, now forward, and just keep that circle to go and do 2 in that direction. So you can see, simple to complex. I took half the car, I had her reach, I had her retract, had her reach, had her retract. That's half of it. Now, let's make the full circle. You could break all your cars down to halves. It's an amazing tool to get you to understand them. So as she's doing that, make sure you always do both directions. Your rib cage is round. So it's round here, so the shoulder blade needs to glide back on it this way instead of going straight back. If it goes straight back, you'll get elbow bend. Make sure you're thinking about it actually gliding around the rib cage. Okay? Nice little cue for you for that. Good. Okay. So now we're going to go into our elbow. So for the elbow, what we're going to have her do is actually use some feedback. We're going to take her left index finger, put that on the inside of the elbow. And then from there, we're going to have her think about rotating out as far as she can. Think about there's an X here and it's actually turning out. When she holds that, we want to go ahead and flex. As she flexes, I want her to squeeze her bicep as hard as she can so that her forearm gets as close to her bicep as she can. If she squeezes too hard, you'll start to see this happen. We don't want that. We want that to be nice and straight. Now she's going to flip her hand over, which is rotation happening at the elbow here. Now straighten the arm all the way out. Oftentimes we have problems with straightening our arms out, so I want her to use that tricep or something else we worked hard for to straighten all the way out. Good. And now rotate, continue your circle. We're really thinking about the rotation happening at the elbow. Try to connect with the actual inside of the joint. That's another thing that we're really working on, is communicating with the capsule, which is the deepest part of that joint. From here, we're going to reverse direction. She's going to come all the way up. When she comes up, you should see her relatively in front of the shoulder, then flips all the way out and around. Just gonna go ahead and do one more of those, especially if you're having any issues with the elbow when you wake up in the morning and you've been sleeping on it a little bit funky. This is such a great way to get rid of it. A lot of pull-ups, a lot of deadlifting. Those things are really gonna help as far as getting the cars in so that you can still do those movements pain-free. We're gonna go ahead and switch sides, same thing. As far as the angles on this one, could she totally do an elbow car from here, here, yes, anywhere? We could really take all of your cars and hit them from different angles. I suggest using the angles that you spend the most time in. So if you know that you're gonna be overhead like this, and you're gonna be doing shoulder pressing and pulling and pull-ups and all these other things, your elbow should be able to rotate from there too. Just finishing up this last 2 reps. As we flip the hand over, you'll notice the hand will actually start outside of the shoulder, and then as it flips over, it'll actually go inside the shoulder and be lined up with it. If the shoulders or the elbow is a little bit wonky and it's bad, you'll start seeing a lot of this hand stuff going on. You'll do some weird stuff with your fingers and your wrist, and your shoulder or your hand will just be in a different place. Okay? So look for that. Next one that we're going to do is going to be the wrist. What we're going to do is have her straight out to the side. I want you to think about having an X on here, a book, your phone. You can even use that. And we also want our fingers to stay completely straight the whole time. So at no point do your fingers bend at all. From here, she's going to go ahead and flex and bring that towards her and just hold that. As she holds that, we should feel this muscle working. So your forearm is what's doing it. Then she's going to go ahead and flip all the way around and continue her circle. When we go back to the extension where she is right now, she should feel this stuff shorten and work. And now she's going to come all the way through, continue that circle. We're going to do 2 in each direction. As we come around, be conscious of the fingers. We don't want them to bend. We want to make sure that the movement is coming from the wrist. You should feel the musculature around the wrist actually working. And you should feel tension in certain places, especially in the palm of your hand. You might feel like it wants to bend your fingers, but that's you learning how to control that tension and not allowing it to dictate your movement. So we're gonna reverse directions as she just did. Make sure you always do both directions, super important. Nice, all the way around. We got one more rep. She's using tension. We're even squeezing a little bit of this fist. Doesn't have to always be 100%, but you can see towards the end of this video, you'll see the C.A.R continuum where I talk about the tension. Good. Take notice of which wrist is a little bit different. We definitely want to be learning. Remember, the C.A.R is a daily assessment, meaning as soon as I wake up and I do my C.A.R, I know which wrist can do this, which one can't, which one's a little bit worse than yesterday. Maybe there was something way I slept, some way I did. Maybe I did some other things that need to be kind of ironed out, and that's where your C.A.R can really play a pivotal role in keeping you healthy for the rest of the day. Good. Okay, let's go ahead and finish that last one, bringing it all the way up, and then we're going to move on. All right, so next controlled articular rotation is going to be the spinal. What we're looking for here is I want her hands directly under her shoulders and her knees are directly under her hips. So her spine's nice and long right from the start. You're going to start in any position you want in terms of whether it's cat or cow or whatever animal you want. So she's going to start off here. We want to be able to articulate the spine, not only one by one, but we also want it to be able to move from the top down and the bottom up. So as she goes through this, I want her to slowly think about the bottom of her spine is going to start getting pulled up to the ceiling one by one. Super slow, taking your time. As it crawls up your spine, you're thinking about that wave running through each individual vertebrae. As we get to the top, the shoulder blades are going to move, but we don't want them to shrug. So you'll notice she's not really shrugging to her ears. It's actually this, her spine, that's moving up. So from here, she's at the top. What I want her to do is take a few breaths. So big, deep breaths. This can also be a really good assessment for you. You'll see all kinds of different stuff here with people. Some people have a really hard time rounding their lower back, even though they've been sitting in a chair the whole time. We want you to be able to round your back. We just don't want you to stay there for 8 hours every single day. So as she's doing this, she's exhaling fully. She's pulling her belly button up to the ceiling. You might even have seen that she might have even gotten a little bit rounder just by breathing. So just like always, simple, stay there, learn how to be there, let's breathe there. Now, I want to start from the bottom again. So she's going to think about slowly untucking her tail or bringing her belly button down to the ground. And it slowly comes one by one, and you'll start seeing this arch. The ripples in her shirt are a great feedback tool. So you can see when the spine moves properly, one by one, those ripples start to come. They're not going to be perfect, but you can really tell. Sometimes you'll have someone who has no ripples on their shirt and it's like, well, you didn't really move at all. From here, really important, she's going to pull her armpits into her back pocket. So she's using her lats and she's thinking about her sternum right here is going to get pulled through her hands. You should immediately feel that fire up your paraspinals and your upper thoracic. From here, we just did reps from the bottom up. Now let's see if you can move from the top down. She's going to try to move this stuff before this moves. So she's pulling my hand up to the ceiling, slowly moving through. And you're going to see with a lot of people, this is going to be the first thing to move when she tries to move her upper back. So you take that towards life. Every time you need to rotate in your golf swing or you're running and your thoracic needs to move, your lower back jumps in and says, it's cool, I got it. Probably not going to work well for a few miles. So when we get to this other position, again, everything's nice and round. The spine is what's moving. Notice her hips are not moving back and forth. She's not hip hinging. She's also keeping her elbows straight. They're not bending. Now we need to move from the top, again, down. So she's going to think about pulling this to the ground. One by one, starting to move it. As she climbs or as she goes down her spine, we want to make sure that the lower back wasn't the first thing to move. Just keep that going. And same thing with the ripples on the shirt, you can really see. You're going to want to video this so you can see what doesn't move. It's kind of tough on her because everything moves really well, but you'll see some people, especially in the upper back, it'll just be a complete dead zone with no movement. that's when you want to get into your hinge point training. That's when you want to move on with all the other stuff that I'm showing you how to correct that. So there's your 2 reps from top and bottom. If I'm going to have her here, which is going to be a struggle for most people, I'm going to keep pulling these down. I'm going to create it isometric. I just want her to stay here for 3 breaths. You should feel the spine firing up and lifting your chest up. This stuff pulls down to lift the chest up. That's how you achieve thoracic extension. So go ahead and give that a try. Okay, so the next one that we're going into is going to be a quadruped hip car. So again, with the quadruped position, make sure that you got your hands under your shoulders, knees are under the hips. I also want your spine to be long. Depending on where you're struggling, you're gonna go ahead and have a little bit of a difference. So we want it to be super long. If you're someone who's stuck in flexion, you might need to think about tilting your pelvis a little bit. If you're someone who's stuck in extension, you might need to get a little bit more abs and pull that up. So you can kind of see from the side, everybody's gonna look a little different neutral, but either way, we don't want you to be collapsed in the spine at all, and you definitely need to be able to use your abs. So for right now, I'm gonna use this as just a little feedback so you guys can see. I want this to be on her lower back. If this falls off, or even if you just see this elevate a lot, you're gonna end up seeing that she's no longer moving through her hip. Her pelvis might be coming a little bit too much, which ends up ending into the lower back movement, but we really wanna keep the circle small, or keep the circle big but under control. So from here, she's gonna go ahead and make sure she goes through a bracing sequence, exhale the ribs down, get abs tight, sniff some air, so she's got air trapped in her lower abs and even her upper abs. From here, we're gonna start with this right knee. It's not gonna go out at all. She's gonna bring it as far forward and hold. As she's here, notice the block didn't change at all. Very well done. She's not leaning, her elbow's not bent. Now she's gonna go out to the side. When we lift out to the side, her knee should be higher than her heel, hold that. So her side butt is what's lifting it. Now staying here, she's gonna start turning this heel up to the ceiling and then coming back into extension. Hold this position right here, super important. You'll notice that her lower back's not arching. She's using her butt and her hamstrings to hold this position. Now she's gonna come down towards the ground. So that's half of your car. Always make sure you do both directions. Now she's gonna kick back as far as she can without arching that lower back. Then she's gonna bring the knee towards you, and then we're gonna rotate from the hip, which is actually the heel coming towards the ground. It comes all the way back and around. She's gonna go ahead and do one more of those for you. So first, knee stays in, comes straight forward. Knee goes out. Now, heel turns up to the ceiling because the hip is turning. Comes all the way around, down, good. Kick back, look for lower back extension. Don't arch the lower back, keep those lower abs tight. Knee comes out, then the hip starts to rotate. We start bringing heel to the ground and around. Great job. So say she was struggling with one of those positions. Go there, stay there. Take 5 or 10 seconds, hold it, own it. Make sure that you're not compensating. If you need to make your circle smaller, it will just shrink a little bit, but as long as it's controlled, it's a way better move than having it big and out of control. So next one we're gonna be going into is going to be the knee car. This one's really difficult, especially at first. What we're gonna have struggles with for most people is tibial internal rotation. So the ability for her knee to actually turn inward like this and outward like that is the rotation part, and then we have flexion, extension, extending the leg. So because people struggle so much with the internal and external rotation, what we're gonna do is go through a little drill just to kind of create a little bit of feedback and be able to kind of execute that. So what she's gonna do is find those little strings that are literally on the outside of her knee. So go ahead and take your left hand, find that one. Right one's here. It's okay if you're not, a palpating expert. Once you find those strings, go ahead and travel down to the hamstring belly, so maybe a couple inches down, and then just kind of have your hands down there. So from here, she's gonna go ahead and use this as her marker, and we're gonna try to pull the knee inward, so we're gonna go that way. She should feel the hamstring in her left hand contract. Hold that right there. So she's gonna hold this for 5 seconds, thinking about squeezing that hamstring a little bit more. As she does that, we get a 5 count. Now she's gonna slowly come back to the other side, and now that outer hamstring is gonna fire to pull that way. So you can see we want this to be moving. At this point, you saw how that just stopped about 2 seconds ago, and her ankle continued to move. So super difficult. We wanna really be able to dissociate though. It's gonna definitely take time. So we're gonna go ahead and have her do 2 reps in a row, just working on this going in and coming back out. As she's doing that again, you're using your palpation, you're using your technique to really feel the hamstring working. That's going to create a better connection, and you'll be able to really get better and better at actually understanding it. Think about almost like they're playing the strings. The one on the left has to shorten, so her inner hamstring has to shorten in order for the shin to go that way. The one on the right has to shorten for it to actually turn that way. So now she went all the way in. We're going to hold that, so she's holding in right now, and she's actually going to go ahead and change her hand positioning. So we're going to take that right arm, we're going to grip it under, she's going to grab left bicep, and then we're going to get nice and tall. When we get into this position right here, I need her spine to be long, which is going to be a struggle for some people. That's okay. And what we're going to do is stay in, and now she's going to straighten her leg out. It's okay if it doesn't get all the way straight. We can get right to that point. Now she's going to turn the shin out and go down. So now you can see we're kind of drawing that circle. Stay in the same circle, go in, go all the way up. These hands in the bicep right here will give you feedback on whether your hip is turning instead of your knee. Coming all the way down. Once she comes down, let's stay in that same direction out and go up. So you're just reversing directions. As always, make sure you do your CARs in both directions, and then come all the way down. One more, rotating out, feeling the hamstring doing it, coming all the way up, in, and down. You're thinking about this is your marker, not the ankle. Go ahead and relax that. So as you're doing it, try to really think about we're trying to affect the stuff around the knee instead of down here. If you think about down here, you're gonna go ahead and always have your ankle driving the motion. Try not to. When we do our ankle CARs after this, you're gonna see the difference between the two and really focus on it. Okay, so next we're moving into the ankle CAR. Remember, as we discussed with the knee, now we're trying to dissociate the ankle from the knee. So as we use this for our marker on our knee CAR, we actually don't want this to move. So if you see this moving side to side, that's the most common compensation. That means that you're going to be moving through your knee and no longer moving through your ankle. The other thing to consider here, when you first start, it's perfectly okay to move your toes and just let them come along for the ride, or maybe even you notice, so pull your toes towards your knees and flex your ankle. You can leave your heel down. So as she does that, you might notice, do a few times like that, you might notice that her toes move first, especially the big toe when you're doing that. Is it a compensation? Definitely, because you're not moving your ankle, you're moving your toes, but at the same time, if anything's going to be mixed together, those would be okay. Do some reps where you actually try your hardest to differentiate between your toes and your ankle. Think about the motion is coming from here. So we're going to start down, so like gas pedal down. The other thing is you want to be able to be strong here. So as she stays here, I want her to push into the ground for 5 seconds. She should feel her calf working to actually push into the ground. So know what tissue is working. From here, we're going to go ahead and come all the way up. Now the shin should be doing that. So I'm gonna have her hold that. She's gonna squeeze the shin, trying to max out dorsiflexion. Now we're gonna go that way. So her ankle's gonna rotate that way as far as she can. If she goes too far, again, this will start to turn that way. It did not move at all. Now gas pedal down. Once she hits the ground, she's gonna go ahead and come all the way to here. As she comes to here, pause. Now what I want her to think about is her pinky, or this outside of the foot, is actually coming up as this inside of the foot goes down, so her foot's flipping. Now as it comes up, she's gonna pull, fire that shin, rotate all the way in, come down to the ground. We'll do one more, coming this way. Then again, foot's flipping, coming all the way up. Always do both directions, reverse, come down, all the way around, nice and smooth, pulling that up. Feeling the movement happen at the ankle, but knowing that the shin, all this tissue pulls up, all of the tissue in the calf actually pushes down. Within all this stuff here, you're gonna have stuff that turns in, stuff that turns out. Really feel for the sensations of those things happening as you're doing them. Okay, so the next thing that we're going to be looking at is your toes, which actually really play a very, very pivotal part, especially in the gait cycle. If the big toe is not able to lift a certain amount actively, that means that you're going to be getting there a different way. So the ankle is going to roll out, which is going to cause complications upstream. Knee, hip, eventually get to your spine. Before you know it, you could have neck pain just because of the way you're walking around incorrectly. So what we're going to do is do a little assessment. Think about with these, you could come up with as many variations as possible. The other thing is you can do both feet at the same time. You can do one at a time. We're going to keep it simple. We're just going to show you the right foot right now. So first thing, this part of your foot and this part must stay on the ground. So she's not allowed to go from the ankle in order to fake motion at the toe. First thing, big toe, lift as high as you can. As she lifts it, I want the other ones to stay down. If you see a little flickering, like it just doesn't lift up, just keep trying. You might get a little bit of a cramp too. That's okay. It's just confused, haven't connected with your toes. Just keep trying. As she's holding it, I want her to think about her brain is signaling all the way down this chain, and there's tension running through this so that this is lifting higher and higher. So we held that for a good 10 seconds. Let's place that down. Now she's going to lift it all the way up one more time, big toe. And we're just going to tap the ground 5 times with it. So now, just as simple as could be, we lifted it. Now let's own it. Let's control it just by tapping it. Say she did 5 of those. Let's move on. We're going to keep the big toe down, lift all the other ones. Good. So you can see that's clearly a decent amount of range of motion there. With her big toe, it's definitely enough, but if you're any less than where she's at, we're probably going to actually really want to work on that. Keep holding that. Same thing with the line of tension. You're thinking about affecting that. Now what I want her to do is try to tap the ground with those 5 times. Good. So you can see just coming up with simple variations. Now we're going to lift all the toes. Say she did 5 of those already. Now I want her to tap just the big toe here. So now it's a little different. All the toes are up, but we have to tap the big toe. So that's going to add a little bit of variability. So say she did 5 of those. Now we're going to go with the other 4 toes. This one's real hard. So you can see a lot of people are going to struggle with that one. So that's something that she needs to work on. Now lastly, we're going to go through a piano. So she's going to lift all of her toes and just one by one, pinky to big toe. Try to slowly individually place those down. Do a couple of those. If you're having trouble lifting any of them, you can literally just hold first and then add in some variations. Eventually you can do both feet at the same time. Another way to really progress that would be even just to get into a combat base. So you could be here and then do your toe work. You could also be in the bottom of a squat. Really, you want your toes to work everywhere. So just kind of figure out where they don't and kind of work in those positions.